All blood vessels, shown in red color, are called arteries. An artery is a blood vessel that carries blood from the heart to other parts of the body. The back part of the brain has areas that control all functions necessary for life. This part of the brain is supplied by the basilar artery, which is formed by two arteries joining together. Now we will explain the problem the patient is facing. Some patients have more fat in the arteries supplying their brain. A small part of the fat can get removed from its location and travel into the arteries of the brain. This clot can block the red artery and stop the blood flow to that part of the brain. Doctors call this problem a stroke. Some patients can have a clot in their heart which can travel with the blood flow to the arteries of the brain. This can also block the artery and cause a stroke. Depending on which artery is blocked, the patient will have different problems. There are 3 kinds of tests that can be done to check for this problem. A CT scan is done to identify if the blood clot that is blocking the artery can be seen, and to find out what damage it has done to the brain till now. This is followed by a CT angiogram test to look for the location of the clot. An MRI scan might be done to better identify the affected area and how much damage has happened to the brain till now. In the case of a stroke, the patient must be treated urgently to prevent further damage to the brain. At this point, opening the artery to remove the clot can still help the patient. If the clot is not removed, the artery will be completely blocked, and the part of the brain supplied by this artery will stop functioning. As a result, there may be a severe damage to important parts of the patient's brain, and their life may be at risk. Now we will explain the treatment options available. At NIMHANS, we remove the clot to clear the block in the artery through a process called thrombectomy. This will treat the stroke and restart the blood flow to the brain. To remove the clot, an angiogram test of the blocked artery will be done. Then we will put a catheter tube till the location of the clot and apply suction to remove it. During the procedure, we might decide to inject a medicine inside the arteries to dissolve the clot and clear the block in the artery. For some patients, the clot cannot be removed by applying suction. In this case, we may try to remove it by using a stent. A stent is a hollow tube that is inserted into a blood vessel to keep it open. We might also have to leave the stent inside the artery to ensure that it stays open. After the procedure, the patient will need neurological care and will be transferred to the neurology ICU or ward. There are certain risks involved in this treatment. While removing the clot, it can break into smaller pieces and go to smaller arteries and block them. This can cause some new problems to the brain and the body, but this cannot be predicted. At times, the clot can be difficult to remove, and then the artery cannot be cleared. By removing the clot, we are trying to prevent further damage to the brain. However, the problems that have already been caused may not recover. If there are any complications and the patient develops new problems to the brain or the body, the patient's hospital or ICU stay may increase. If the patient has related cardiac or heart problems that caused the stroke, they might need more cardiac care. Since NIMHANS does not have any cardiology department, the patient will have to be referred to a cardiac specialty hospital. The patient's cardiac condition may have an effect on the final outcome of the treatment. We hope that this presentation has helped you understand the patient's condition and the treatment for it.